And a very warm welcome to all of you. I am Dr. Devang Shah from the Other Song Academy. I'm an in-house consultant at the academy, and I have been associated with the academy since the last 6 years, that is since its inception. And I'm happy to answer your questions which are asked on the basics of homeopathy. So the first question which I receive is, homeopathy takes a long time to act. Is it true? Now this is a very interesting question, and I would like to answer it with two simple examples. First was a case of a colleague who was working with me here at the academy, and he developed a severe toothache, and he came to me and he says that, can you give me a remedy? These are my symptoms. So I noted his symptoms and I prescribed a remedy. And I asked him to inform to me in the evening, and the toothache was really severe. So I said that, okay, then you do one thing, let me know in 3 hours. He took the remedy, whichever I prescribed, and to my surprise, in half an hour, he comes and says that there is no toothache. He says that the moment I put the drops on the tongue, the pain started reducing. Now this is one case example which shows the action of the homeopathic remedy. I would like to give you another example. This is a case of a man who was having chronic cramps in his legs, and he was a known case of diabetes. And he consulted me mainly for the cramps. I prescribed him a suitable remedy, and in 3 to 6 months, his cramps kind of vanished, almost not there. If at all it happens once in 2 months, which was once every week. As he found some relief in his cramps, he asked me, doctor, is there any medicine for my sugars? Because I am taking medicines for it, but my fasting is always 140, 150, sometimes 180, in spite of whatever diet and exercise or whatever I am doing. So I said that I am already giving you the medicines for your sugars, because these medicines are based on your constitution. So it is basically a holistic medicine. But he says my sugars are not showing any relief. I said, let us take this medicine for another 3 to 6 months and then evaluate. After 3 or 6 months after 1 year of treatment rather, he says that, doctor, for the first time my sugars have been below 100 and I'm not doing anything different. The only difference in 1 year is that I've started homeopathic medicines. So what I want to say is, here we see that there is a stark contrast in these two cases, the first case and the second case. First improved just in half an hour, and the other one is still improving, and it's around 1 year or even more than 1 year. So what is this? Why does this happen? Basically, the action of homeopathic remedy depends upon what disease you have, what is the pace of the disease, and thirdly, it is your individual response to a particular homeopathic remedy. These together will decide whether the action is going to be fast, slow or medium. So generally I tell my patients or share with them that there is nothing like a fast or a slow action. It only depends on your disease, your illness, how long the illness is, how chronic the illness is, or how acute or how intense the illness is. The second question is, do homeopathic medicines have side effects? In my experience, I have seen that there is no side effect of any homeopathic medicine. Third, can the medicines be taken with allopathic medicines? So I see many patients who are on allopathic medicines, and in spite of that they improve and do well on homeopathic medicine. Like the case which I shared with you, he was already on allopathic medicines, his sugars remained 140, 150, but still he was on homeopathic medicines, and after a period of 1 year he sees a drastic improvement in his sugars. Same thing applies for patients who are taking medicines for thyroid, rheumatoid arthritis, SLE, joint pains or any other illness. They come with asthmas, etc. or skin complaints. All these patients who are already taking allopathic medicines can take homeopathy both together, and as we come to know that the homeopathic medicine is helping them, we gradually either reduce it, or we ask the physician who is treating, or we request them that since the patient's sugars or the reports are well within normal limits, can we reduce the allopathic dosage and evaluate in 3 months and 6 months and see what is happening. So both the medicines can be taken together. Now, fourth question is a very interesting question, and I like this question very much. The question is, can homeopathic medicines aggravate the existing problems? And I would like to give a little detailed answer to this, because there is a general belief that homeopathic treatment increases the problem initially. And I would like to correct this with a case example. The same patient whom I shared in the beginning, who was having diabetes and all that, and after 1 year we see that his diabetes sugar levels are coming well within normal limits, both with homeopathy and allopathy, which were earlier higher when he was only on allopathic medicines. But it was interesting, when I saw him 2 months back, he says that, doctor, there is a new problem which has started coming up. And that problem is, now I am developing recurrent cold and cough. And this problem I used to have long back, 10 years, 15 years back, and the same problem is coming up, and I am really tempted to take allopathic medicines. This is the point I explain him something about homeopathy. I tell him that this phenomena is called as exteriorization in homeopathic terminology. What does it mean? Normally, our body is capable of defending any form of illness. When the body's defense fails, or when something happens where the body is not able to cope, then the body tends to compromise. And that compromise generally comes in form of a disease. That disease depends on what genetic weaknesses which we are having. Now, generally the body tends to compromise by getting affected in the most superficial part of the body. So for example, I see a lot of children cases or a lot of adult cases who have had asthma. They say that the chronology of the illness is that initially they had eczema, then they had applied some ointments and all that, and after 5 years, 10 years, or maybe 1 or 2 years, depending upon their disease speed, they develop recurrent cold and cough, allergies, then they take medicines for the same, and then they develop heavy head and sinusitis, and later on maybe they develop asthma. So what is happening here is, the disease or the body which is compromised initially was affected at the skin. Now skin is the most superficial part of our body. The body is trying to defend itself by creating an eczema. But if that eczema is not treated in the right manner, it is going deeper and deeper. Means what is happening? It's affecting the skin is not getting healed properly, the disease goes inside, means it's affecting the nose, later on the sinuses, and maybe later on the chest, leading into asthma. With homeopathic medicines, what happens is, I have seen that when you treat a patient who is having asthma or sinusitis or allergic cold and cough, the colds and coughs or the asthma tend to reduce. Then the patients might say that, doctor, you know what, the complaint which I had when I was a child, those eruptions or those eczematous patches are again coming back to me. That is the time we explain them, this is what the homeopathic medicines are ought to do. So it is not actually that they are increasing the complaints, but whatever suppressed problems were there, which were not tackled in the right manner, the body is kind of throwing it out to the most superficial part or the system or the organ of the body, which is exactly what is happening in this case of diabetes. His sugars are getting better. Now diabetes is the disease of the pancreas where it is not able to produce a lot of insulin. But as the body is kind of getting better and better from inside, you see that something is happening at the superficial level, which is the nose, where he is getting recurrent cold and cough. And then we tell them that don't take any other form of treatment. We will help you with homeopathy to come out of this illness as well. So it is not necessary that it is kind of showing any aggravation, but all that was suppressed in your body because of not the right form of treatment, it is coming out to the most superficial organ of the body. This is exactly, this kind of a follow-up is a dream follow-up for each and every homeopath. Then we have another question. Do complaints recur after completing the course of homeopathic treatment? If yes, what to do? Yes, there have been cases where patients have a recurrence of their complaints. And in such a scenario, what they can do is they can fix up an appointment with their homeopath again, maybe for half an hour, 1 hour, where the homeopath sits with them, re-evaluates that state of mind, fears, dreams, the situation of stress, what other changes have happened in their life, in their behavior, in their mental pattern. And based on these new symptoms, either he prescribes the same if it is indicated, or he might change the remedy, and completely a new remedy is possible, definitely. How frequently do we need to see the doctor for our complaints? Well, in a chronic case, generally I see my cases once in 3 weeks or once in 4 weeks, which is 1 month. And if it is an acute case, I see to it depending upon the nature of an acute. Like for example, I had an acute today where this lady is having swelling of the hands and the pain is really, really severe. To the extent that, she says that should I get an X-ray or get investigated or show it to an orthopedic. In such an acute case, I would like to follow up every 4 hourly. Or there may be another case where, this child is having fever in the afternoon. Fever is 9900. In such a case, I would see him once or twice a day is minimum, which I follow up with my patients, morning and evening, and if needed in the afternoon. So in acute, the frequency is depending upon what kind of illness they have. Then, do we have different medicines for different illnesses? Well, homeopathy does not have a particular medicine for a particular illness. It is not like you have rheumatoid arthritis, okay, you take XYZ medicine. You have asthma, you take ABC medicine. No. Homeopathic medicine is a tailor-made medicine. What do I mean by that? A patient who has an asthma or rheumatoid arthritis comes to us, he narrates his complaints. He says, asthma is better by XYZ things, asthma is better by XYZ, ABCD things, etc., etc. Then we understand his mind state. What do I mean by mind state is we understand his fears, we understand his dreams, we understand his stressful situations. We understand how does he cope with all these situations. We understand if anything has happened in the childhood. We understand his nature as a child. After understanding all possible areas of a patient's life, we arrive at a particular homeopathic remedy which is made for that particular patient or that particular patient who is suffering from asthma, which is exactly opposite when it comes to modern medicine, where the medicine based on diagnosis. Here the medicine is based on the individuality or the nature of the person or the personality of the patient. So irrespective of the diagnosis, the medicine differs from patient to patient and diagnosis to diagnosis. 10 patients of asthma will receive 10 different medicines because they will be having different nature, different stress, different fears, etc., etc. So these were the questions which had come up for this first live session, and I am happy to answer them. I am sure you must be having some more questions after hearing this talk, and you are most welcome to send more questions. So maybe me or my colleagues will get a chance and an opportunity to answer those questions, and we are in a process that we want to kind of remove the myths which people are carrying about homeopathy, like for example, which was the first question, that it is slow acting, or whether homeopathic medicines can increase the problems, etc., etc. Thank you for listening this, and I wish you a very good evening. Thank you.